Well, I think we'll go ahead and get started. And I'd say, first of all, good morning to everyone. On behalf of the St. Joe Community Health Foundation and our sponsor, the Poor Handmaids of Jesus Christ, I am very privileged to open up this conversation this morning on behalf of the PIC and Infant Care Network. I am on this call, two other members of the St. Joe Community Health Foundation team. We have Mark Burkholder, who is managing the call, and he, as a matter of business, I'll share with you that he has muted everybody except the speakers, so we get less background noise. But if you need a question, and you please use the chat box, put it in there. Mark will respond either right away or at the end. We'll take it in the question and answer session. So please use that and work with Mark if you need any assistance during the call. Also helping to organize a lot of this is Laura Dwyer, who is our community programs manager. And you'll be hearing from her, I think, a little bit later in the call, as she's done a lot of the logistics to put this together. So on behalf of us, I want to thank all of you for joining us. I also want to thank, we have a really great advisory board for the Prenatal and Infant Care Network. And we've got representatives from A Hope Center, Healthier Moms and Babies, the Lutheran Health Network, Lutheran Social Services, Macmillan Health, Parkview Health, Women's Care Center, and Dr. Laura Overton all serve on that advisory committee, and we really appreciate their help. They have been meeting since the beginning of the pandemic every other Friday, advising us on topics and helping us to get information to different people as it's needed. So I want to thank them. Before I go into today's speakers, I do have a couple of things I want to share with you. I did receive a few requests this morning, two requests from the Allen County Health Commissioner, Dr. McMahon, if I could share with you all two messages that she thinks are very important. First, it's about face masks. There have been some very cute face mask pictures out on Facebook, etc. And there is a concern, and I want to share this with you, a message from Dr. Tony Giaquinta, who is with Parkview and also who is the head of the Indiana Academy of Pediatrics, that while face masks are recommended, they are not appropriate for everyone. Babies and children under the age of 2 should not wear a mask. And if you, as care providers, I think all know this, but if you can be reminding families, encouraging families to know that, there's a great deal of concern that this may cause some suffocation or other problems in the children that we've been working very hard to avoid with safe sleep practices. So we really want to keep pushing that message out there, despite a lot of cute Facebook pictures that are starting to appear that might be encouraging people otherwise. The second message she asked that I relay is on infant vaccines. And the CDC recommends that childhood immunizations be maintained during the COVID pandemic. Locally in Allen County, and it's open to anybody in the region, that Super Shot is providing vaccines. They've had people come who have lost their insurance. That's Super Shot provides free vaccines or at a very low cost. And they have stayed open through this whole pandemic. It's important to note that they're taking requests to vaccinate by appointment only, but because they are doing it very carefully to protect everybody in there, how they can come into the building, it is not as, if you have an appointment, it will be faster than it used to be because they don't want people standing outside, but it does take more time. So if you also have people who will be going back to school in the fall, they should start early this summer. So we ask that everybody start recommending to stay current with infant vaccines and to be working on those children vaccines, because we do not want to have a large crowd hitting in August either for people to coming in. And again, Super Shot, and the information is on the screen, how to get current now and stay current through the summer and be anticipating for the fall. So those are the two requests from Dr. McMahon, our Allen County Health Commissioner. And now for today's topic, I want to share with you that I think it is very important on housing as one of the key areas that people are struggling with financially. Laura Dwyer just identified a really important piece of information that I think was kind of startling to me and also probably to all of you, that housing stability is a major unaddressed need in the face of the pandemic. And estimates from the National Low-Income Housing Coalition find that Indiana will see a surge of 43,800 newly low-income renters as a result of COVID-19. And a total of 205,837 renter households will need emergency assistance, which just really brings why this topic today is so important. And with that, I really want to turn it over to some of the local experts who really will lead us through how do we talk to our clients about this, as well as what are the resources in the community and how can you help clients access this. Our speakers today are from SCAN, Stop Child Abuse and Neglect, and Lisa Blanchard is Vice President of Prevention Services for SCAN, and she will open our conversation. And then we'll be joined by Kristi Stanley, who's the Director of Intake and Grants Manager with Lutheran Social Services of Indiana, and as well as Libby Martin, a Director of Case Management with Lutheran Social Services. And I'm delighted we have these experts, and I'm going to turn it over at this point to Lisa to go forward.
All right, good afternoon, everybody, and welcome and thank you for giving me this opportunity to share with all of you the programs that we have available to help families. So I wanted to start out and tell you a little bit about some of the programs that we have. And so many of you are probably familiar with our Healthy Families program that we administer through SCAN. But we also have another program called Community Partners for Safe Families. And this program actually serves 16 different counties in this northeast corner. So everywhere from St. Joe County down to Howard County, and then up to LaGrange, Steuben, DeKalb, Whitley, Allen, Noble, and some others in through there. So we cover a wide range of the area in the northeast corner of the state, and we can work with families who, from the time they give birth up until the time their youngest child turns 18, they would be eligible for our services. And it's kind of a wide range of things that we can work with families on. And so these are families who wouldn't necessarily qualify for Healthy Families or who aren't involved with the Department of Child Services, but need some assistance. And we help them set goals, and we help them connect to their communities, and we help them become stronger families, better parents, and overcome obstacles that they might be facing. So right now is kind of an ideal time for people to be taking advantage of this program, because we are we're seeing more and more families who may have not ever considered the fact that they would need assistance, right? They, have felt pretty stable. They might have been living paycheck to paycheck, but now all of a sudden, due to these circumstances, they're really kind of lost because they don't know where all of these resources are in our communities. They don't know how to access them. They're embarrassed. They don't know how to say, I need help. They might not even know how to identify that they need help. And so our assessment teams are really skilled in helping families realize where their strengths are and where we can come alongside them and help with them. And I think that's really important, is that we don't approach this as we are experts and you're doing something wrong and we need to come in and fix it. We want to approach this as we're working side by side with a family to help empower them to find answers for themselves. And so create this really welcoming atmosphere that's very strength-based to engage a family in our services. We are, we're looking at helping families at all kinds of different levels. If you are working with a family and you're kind of like, they probably do need a little bit of assistance, go ahead and send them over to us, and we can have conversations with that family to decide what they do need. We can do anything from a couple of phone calls to a couple of home visits to 4 months of services. They also can come back as many times as needed. so if they have 4 months of services and they complete that, and a few months later, or 6 months down the road, they need more assistance, they can come back, and we don't limit the number of times a family can come back to us. And it's really about talking to the family about what their goals are. So we do a full assessment and get to know the family's history, and really we want to hear their story. So one of the things that we find is really important, and a skill that you all might be able to take from that, is asking open-ended questions. And so really asking a family about, you know, what does your daily life look like right now? And then just waiting to kind of hear where their response is, so that we can then take that in different directions. You know, things that families might be facing right now, you might ask a question about, have you been able to pay all your bills? Well, that's a yes or no question. A family might say yes to that, but really they haven't paid any of their bills because they know that right now the utilities company is forgiving that for a few minutes. And forgiving isn't the right word, because eventually they're going to have to pay that, right? And so if we ask, you know, how much was your utility bill this month? And when was the last time you paid your bill? Or what does your budget look like? Those are all open-ended questions that help us gather more information about what they might actually be facing. I mean, and if you think about it, if somebody asks you a yes or no question, it's really easy to just say, oh yeah, sure. And that might not really be the truth, or you might not have really stopped to think about all of the obstacles that you're facing. So as you're asking some of those questions, think about ways that you can open the door for them to tell you a little bit more. Because that's where you're going to find the honesty in what's really happening. Because what we want to do, and what community partners can help people do right now, is we can help them stay on track, right? We don't want them to fall behind, and then in, you know, a month from now, 3 months from now, when all of their bills come due, we have this kind of overwhelming need in our community. So the most that we can do right now is stick with those families and help make sure that they've got a plan, and they're acting on their plan, and that they're moving forward, and that they have someone friendly and open and strength-based to help them look at what are all of their options. We can help them access food stamps if they need to do that. We can help them access the trustee's office if they've never had to do that before. And so we partner with a lot of different agencies in the community to help make sure that they stay connected. You know, all of a sudden you used to have grandma helping you, or your aunt, or your neighbors, or your friends, and now you are in your house with your children, and you can't even call your neighbor and ask them to come over and help you because we are social distancing. And that creates a whole nother wave of needs, whether that's mental health, whether it's physical things. Maybe all of a sudden you can't get to the grocery store. And how can we help problem solve those things? And so we are asking questions of our families to find out what their level of need is. And if they need to have face-to-face visits and it is safe to do so, we will continue to do that. That might mean that we help them find some resources and we drop it off at their porch and then text them and wait for them to come out and pick it up, so that we have that no contact kind of things, right? It may be helping them set up a cart to even order their groceries for a click list if they've never done that before. You have grandparents caring for children who might not have accessed technology before. How can we help them continue the e-learning? How can we help them do online shopping, FaceTime, all of those kinds of things, Google Hangouts, whatever it might be, so that they can stay connected to their community. And so that is a really cool thing about the Community Partners Program, is that we're not there for one purpose. We're there to help that family become stronger, whatever it looks like for that family. And so, you know, if you ever have any question about whether or not a family needs some support, you know, please call us and let us talk to that family and try to help figure out what that family might need and might like from our services. Because we really do want to come alongside them to support them. And that could be connecting them to the community to find financial resources. We did receive some additional funding from the Department of Child Services to help meet concrete needs of families. And so we were able to do some of that with it, you know, within some limits. You know, if they have a $2,000 utility bill, we might not be able to help with all of that, but we might be able to help them with portions of that, or find other resources in the community that can. And so there are a lot of things that we can do. And I think the most important thing that we have is that we are really strength-based. And so as families are coming to us, we don't want them to feel that that is a negative experience, or that speaks, that says that they're doing something wrong or that they're failing. Because really, by reaching out to us, they're not. I mean, they're finding a strength and they're connecting to their community. And I think it's really important to know that families just have to find new ways to do that. They may need to figure out how to use telehealth to communicate with their doctors and their therapists. There are all these really important connections that we need to be able to help continue our families continue to make during this time. And onwards as we continue to, as agencies begin to phase back in and they have to continue to navigate what's open and what's closed, that we can be a resource for them to continue those things. And I know one of our staff came up with a safety plan, because I think another thing that's really important to talk to families about is, you know, we can talk to them about budgeting or making emergency plans on a good day, and they're like, yeah, okay, we'll take care of that sometime down the road. Well, right now they might need it. And so this is a really good time to start talking to them about, who is your support system? What happens if you get sick? Who is going to take care of your children? What medications do you take? Where are they kept? What medical conditions do I have? You know, we keep a lot of this information in our heads, right? But then when it comes to a critical time, to communicate that to other people. So we've had a couple of staff come up with what we call COVID safety plans that then can be adapted to all kinds of different safety needs, to really prompt some of those conversations, those what if conversations, so that clients and families really start to think about, what is my plan A, B, C, and D? And sometimes you really just need to have a sounding board to help you figure out and help prompt those things. And so Community Partners is here to help them do that. We want to provide that supportive care that really keeps them moving forward and on track and connected, I think is the biggest thing that we can do for families right now. And Community Partners has been around for like 20 years, and it will continue to be around after this. And so even though we have a lot of really amazing things to offer families right now in this crisis, I just want you all to know that we are here to support the community on an ongoing basis, and that our service model just happens to fit really well with what's happening right now and our ability to support right now. But that service model doesn't change after this crisis kind of starts to taper off, that we are there to support families through whatever goals that they have. Yes, our main goal is to prevent child abuse and neglect, and to help families strengthen their parenting and their home life. But that can look a lot of ways to a lot of different families. And so as long as we're listening to what they need from us and helping them stay on track, that's what Community Partners is here for.
We do have a poll we could do right now, just to kind of a little bit of interactiveness. That Mark, if you can put the poll up there. A little bit of feedback. The great work has been described from Community Partners and from SCAN. We thought it would be helpful to know if those who are participating, if you would just like to click on the boxes and hit submit. We'd like to kind of know, of those who are participating, what do you currently assess or screen clients for at this time? And Mark, when you think we're ready, you'll share that with us, I think.
Sure, yeah, we're at about 25 responses right now.
We'll give it a few more minutes and you can do, but we thought it would be helpful for us to kind of learn from the group and to give some feedback too, for Lisa and Kristi and Libby, but for all of us to kind of know where our strengths are in this group.
I will say, if you ever have questions about how, if you want some suggestions on how to ask open-ended questions about some topics, that, I'm always happy to help you with some of those ideas. And that if you ever have questions about whether or not someone would benefit from our assistance, don't hesitate to call us. So SCAN's number is 421-5000, and you ask for the Community Partners Program, and you'll probably get our administrative assistant who will either answer your question for you or make sure you get connected to the right person. And then my email is lblanchard, so my first initial last name, at scaninc.org.
And we actually have Lisa's email and the other speaker's email on the screen, so if that helps you.
Great.
It looks like we've
That's a great resource. Go
stalled
ahead,
out
Mark.
about 48 responses, so I'll go ahead and share those now.
So the expertise of our group is around health insurance status.
Yeah. And that is so important to make sure they're connected to that right now, and that they are taking advantage of all the programs that are out there for them. And so, you know, if that's definitely a concern, we can help connect them to the navigators in the community, help them know what questions they need to be asking to even get the right insurance benefits. All of those kinds of things are things that we see. So
We've also had a few questions in the chat.
Are they directly for Lisa, or should we wait and do those at the end?
One of them is a direct community partners question.
You want to read it?
Yeah, so it says, if a client is already using a program funded by ISDH, are they able to use the community partners program at the same time?
the answer to that is chances are yes. The only disqualifiers for community partners are if they're involved in healthy families, the Department of Child Services, or they have a child who is residing in their home on juvenile probation. Those are really the only disqualifiers for community partners. Now, I will say that if they have several other case managers in the home, we will really try to look at, are we adding anything to the situation? So if they already have like 5 other people that they're working with, we might not necessarily work with them unless there is something that we can add to the situation. If we can kind of be that cohesive group that brings all 5 of those providers together to the same page, sure, we might jump in and start to try to work with them. But if we're just going to add more confusion to the mix, then we're not going to get involved. And so I think that that's, one of the things that we want to do is it's really important to us to make sure that clients are getting the best services that they can. So if we are not the most appropriate place for them to be, we want to refer them on to the most appropriate place for them to be. We don't want to just be serving clients to serve them. We want to make sure that they are using what's best for them in the community. And so we really will try to connect them. If we're not the best program, we want to find the best program for them. And so that's really important to our model, that we're helping clients get where they need to be, whether that's with us or with another program.
Very good. Thank you very much. We'll jump to the other speakers and then stay tuned if more questions come back. Would be great. I think Kristi Stanley is going to talk to us now about some of the programming that they have done at Lutheran Social Services and some of the strategies to really do financial assessment and training. So Kristi, I'm going to turn it over to you.
All righty. Hello, everyone. Like Meg said, my name is Kristi Stanley. I'm with Lutheran Social Services. I've been at the agency almost 22 years now, so I've been around a little while. And for our organization, we offer a variety of services for individuals, from childcare, employment training, case management, counseling services. But the one program that I wanted to talk about today, or one of the things that Lutheran Social Services is really dedicated, is helping families move forward toward economic and family stability. And one of those things is financial education, financial literacy, financial coaching. Financial education is embedded in all of our programs. So anyone that comes through any of our programs are going to get some type of financial education. And so with COVID coming up, it really, the families that we currently work with are already vulnerable. What's going to happen is it's going to make our vulnerable families crisis families. We're going to start seeing families that had genuinely done okay who will not be okay. These will be your vulnerable population. So one of the things that we really want to try and do is be proactive. I'm sorry, this camera is like, okay. We really want to be proactive with families rather than being reactive. It's much easier to do things when we have time other than not having much time. So one of the things that I wanted to talk about are some things that you can talk with those families that you serve. If you're typically not asking about finances, like Lisa mentioned, asking them some just open-ended questions. Like she said, if you say, oh, did you pay your rent? Well, yes, I paid my rent, but I paid January's rent, or I paid $50 of my rent. So sometimes what I will do is, and I do this a lot, people will say, well, I need $100 from my electric bill. And I'll say, okay, does that give you a zero balance? Does that stop a disconnect? What does that do for you? To really get a good picture of what their financial situation looks like. Right now we're under a moratorium, and that means utility companies are not shutting off for disconnection. There are certain mortgages, if they are federally funded mortgages, FHA, veteran loans, things like that, they are going to suspend foreclosure. It's important for families to understand if you have a mortgage through Wells Fargo, your local bank, credit union, they will foreclose, that you're not exempt from that. And so it's important for families to understand that. For the moratorium for the utilities, those of us that are very familiar with energy assistance, it happens with the utilities, the winter heating program. They have a moratorium where they won't be shut off, but come March, that ends. And so we get lots of calls. I know SCAN gets lots of calls. People have significant bills because they've not been paying on them. We have to remind families their balances will accrue. You still have to pay your bill. I don't know when the moratoriums are going to end. I know, I think that the evictions have been extended until June. But again, we don't know. My hope would be is that they would give us some time, some notice, so that we can help families prepare. But please keep reminding your families, you need to be paying on your bills. If they are struggling, get help now. Get them connected with community partners. They can help get them to the right resources. Stay on top of these bills now. Because what's going to happen June, July, August, they could have a bill that's in the thousands of dollars. And at that point, that's very difficult for agencies to come in and to be able to cover and to stop disconnects. So just asking them, what are your top 3 worries? What are the things you're worried about? See if it's finances, their health, their job. We have families now that are doing fairly well. They've gotten their tax return, they're getting their stimulus check, they're hanging out at home. And so for some of them, they're not doing too bad. I kind of look at it, I kind of talk to staff that this COVID is, we kind of see it in stages or phases. Like phase 1 is, hey, I'm home, things are good, I'm getting a check and I'm getting more in unemployment and this isn't so bad. But then that phase 2 hits and people are getting antsy, cabin fever. We're starting to see, if couples are at home, relationship issues, kids are driving you crazy. I'm lucky my kids are older. I don't know what I would do if I had to do e-learning with 3 or 4 small kids. I just would go crazy. I couldn't help them, I don't think. And so we're kind of hitting that second phase where people are needing to get out. Third phase is everything is, moratoriums are ending and people are getting eviction notices and they're getting disconnect notices. And so we want to be able to reach these families now, talk to them. Even if things are going fine now, asking them, what is your plan for next month? How will you be able to cover your expenses? If they say, I just don't know, that's when you get the services involved. Please be proactive. Because again, it's easier for agencies, us community partners. We actually are a community partner organization, so we are a provider. Please get them involved now before things get really bad or the families get in crisis. It's much easier for us to be able to keep on top of things if we have some notice and not being reactive. Now, I also am very realistic that we know that's not always going to happen. But utilizing the resources, utilizing the agencies that are available to be able to help families, getting that financial education. That's one program that we have, that we provide a financial case management program. It's not so much about us paying bills, but helping people to look at the money coming in, the money that has to go out. Is it balanced? And what do we need to do to get that balanced? And then to be able to start putting back money for savings, so that if a COVID or something else, pops up, when something pops up, family is a little bit better prepared to know what those resources are, to have that safety plan already in place, like Lisa talked about. So asking them, how are you doing? How, what concerns you have? What worries do you have? And then being able to link them with the right resources, like Lisa said, that's best for the family. We all do a great job, but we aren't the best for everybody. And so we want to make sure that we're getting them connected. Let me see. I do want to talk a little bit, as our staff here have been talking about the financial concerns. And of course, there's going to be other concerns. There's going to be mental health. There is now. That's coming later, I'm thinking. And so, but for this LSSI, we came up with a toolkit. We call it our pandemic financial toolkit. And what this toolkit does is it breaks down for families those categories. If they only have so much money, I only have X amount, I don't know what to pay. What should be paid first? So this is our toolkit. And we have it listed by critical and by moderate categories. Of course, for families, they want to focus on 4 walls. Their utilities. Do you have a roof over your head? Are utilities on? Your water's on? You have food? Those are the needs that need to be taken care of first. That's where their funds need to go. And then it starts talking about moderate to where, do I pay on my student loans? What does that look like? We point out in all of these what those stipulations are, as far as when you hear, oh, I'm not going to be evicted, I can't be foreclosed, they're going to forgive my student loans. That's not for everybody. And so, you have to look and understand you qualify for that. Student loans are only federally backed student loans. Fed loan, and I know there's some other ones, but like your Sallie Mae's, that is not included. So families need to understand what's included in these moratoriums and these forgivenesses. If they're struggling with their finances, if they're struggling with their utilities, even though they're under moratorium, they still have to call their utility company, make payment arrangements. They will do that with them. Staying on top of that. If your car loan, we got something here from one of the credit unions. Oh, you can skip 3 months of your payment. Yeah, that might sound great, but what are the penalties? Am I going to have to pay those 3 months on month 4? Are you going to increase my interest rate? What's going to happen to those payments? And so it's understanding what is going on if you decide to not pay a bill, or if you cannot pay a bill. Communicate with your lenders, communicate with your landlord. We also have, I know I saw a question come up, our toolkit is on our website, www.lssin.org. And I think you'll be getting that here as well, but it is available on our website. In addition, we have a lot of resources available to staff, to case managers, to families. We update that almost daily. We have from how to talk to your kids about COVID, activities that you can do at home, because everybody's getting a little bit stir crazy. And so what can you do at home? What are some things that you can do? The resources that are available in the community. Where are the farm wagons? Where is Wellspring? What are community harvest hours? Where are the contact information for your utility companies? All of these things we have on our website. And so please look at that, refer families to that. Once you pull it up, there's a big banner that says COVID. Click on it. It gives you everything that you may need. And so this toolkit can kind of help them. You can kind of go through it and say, okay, well, I maybe really just, I hate to not pay a credit card, but I need to feed my kids, or I need to really pay my rent first. Another thing too to remind families is agencies are going to be looking at how they're spending. You know, we don't judge. We show a lot of grace and compassion at what we do. But if someone's coming to us and saying they need help with their rent, but they use their stimulus check to buy a huge television, we're going to have a conversation about it. That doesn't mean we're not going to help them, but that's where that education is going to come in so that we can help them use those funds for basic needs, saving it so that way they're prepared. We're concerned about the months coming forward, not so much now. What's going to happen June, July, August when there is no stimulus check? People are trying to get back to work. Their hours don't look the same. And so that's why we want to get services. We want to get support there in place. I think that's it. I'm trying to think if there's, Libby, do you want to chime in? Do you want to talk a little bit? Is there something
I will say there was a good question from Tammy just about evictions. So
okay.
Are evictions on a moratorium only for non-payment? Do we know anything? Can evictions be done for other reasons?
So, and again, this is based on my interpretation. So please, even the toolkit, please don't come back and say, well, Lutheran Social Services said that you can't evict me. You know, this is based off of information that we've been able to gather. It is my understanding for evictions, that eviction is really for federally backed housing. So those that are on housing authority vouchers, HUD apartment complexes, if a landlord has a mortgage on that property that's a federally backed mortgage, those are the kind of things that are protected. Now in Allen County, they have suspended seeing eviction cases. That doesn't mean that a landlord can't file eviction. It's just that right now the courts are not hearing them. So we still, again, want to encourage families, talk to your landlord, get enrolled in services. If community partners, if for some reason they don't have children under the age of 18 in their home and don't have those qualifying factors, again, contacting SCAN to see what resources are available. Indiana 211 is another great resource. They can get you linked up with other case management that can help you navigate that with your landlord and see what you can do. So in that, and again, that's kind of our biggest fear is when these evictions are lifted and the moratoriums are lifted, how is that going to leave families and how prepared are we going to be as agencies to be able to handle that? So I don't know if that answers your question, Tammy. So again, you know, if it's just a landlord here in town, they can file eviction. It's just the court, they're not going to process it. They're not going to do anything with it. I have not heard anything yet about when that's going to get lifted. And I've not heard anything about when utilities are going to get lifted as well. So we're all kind of waiting to see when that may happen.
Libby, you have run the case management program, and you've been working with a lot of prenatal and infant care providers through the ECHO program. Do you want to share with us some of the things that you've heard today that you think are particularly helpful, or build on them, or again, challenge either Lisa or Kristi with additional good dig a little deeper?
I created a whole page of takeaways from this, and I know both these programs, so I still created a whole takeaway. So thank you, Kristi, and thank you, Lisa. I know, kind of to wrap up from what I was hearing, I know in our PIC network, we have so many different amazing agencies that do so many different services. And even in Lutheran Social Services, sometimes we offer brief services, sometimes we're offering long-term services. But what I really heard was that we can assess families no matter how they enter our services for these needs. And so I really heard through those open-ended questions, that strength-based, that genuine manner that all of our services offer, we can start being proactive. And so I heard some of those, you know, what's life look like now? What are your top 3 worries? You know, how much was your bill? Those kind of questions. I really heard that through those open, genuine, even if it's in brief services or if we've had this client for a long time, sometimes we don't have those new conversations because that was an old conversation. And so I really took away that, even that, what would bring you to a zero balance? I love that one. That's going to give me a real view of what those expenses are. So it really sounded like we could be assessing for those needs. And then definitely we're given a lot of stuff on that assist, talking about those emergency plans. So I know we're connecting to those medical things, but does someone else hold that knowledge? I mean, I may have just sat here and thought, I don't know if I have someone else holding my own medical knowledge. I need to get that emergency sheet filled out. But then also that financial education. And what I really took away was that getting connected right now is, we may have a family that's like, I think I can do this. I've got this planned and this planned. But if we can get them connected and be proactive through these services, I think we really can make sure that we don't have, just as Kristi said, some of our vulnerable families fall into our crisis families. And right now that can happen in a week, in a month. We don't know when moratorium's end, but we just also don't know what the landscape's going to look like from day to day. And so I really liked that, we can assist and assess and educate through, the emergency plan, even the financial toolkit, but really taking away that referral. We have a community partners that can help families, that really can assist them, especially if it's through a couple of phone calls, if it's a couple of visits, or if it's 4 months. And it's one of those things that's not maybe, one and done. If we stumble again, we really can get back in there. And then talking about, financial case management, that may be something that a family is needing. So when we talk about what would bring you to a zero balance, and they're like, I think I have this, I just have a few questions. It sounds like we have that, we can refer on to that. And then also 211 that holds all those great services and can kind of hold all those needs. So I have to say I had amazing takeaways, and I know both these services. I filled a whole page full.
We have a question too in the chat from Pat Turner. Are there any income guidelines to access your services?
For community partners, there are no income guidelines. That's another thing that's kind of unique to us, right? Like, you don't have to meet a certain income requirement to qualify for our services. So pretty much anybody can qualify for our services, and we're there to help them get through. They might have something very specific that they want to accomplish, and we can help that. They may have a list of like 20 things they want to accomplish, and we can try to help with that too. And so, yes, there are no income guidelines to qualify for community partner services.
And there are no income requirements. I was going through all of our programs, but for financial stability and any of our other programs, there are no income requirements there as well, especially for our Cup of Kindness financial stability. We have people that have zero income, and then we have people that come in with significant income. And there's just a mismanagement somewhere. And so we help to identify that and walk them through that and help them get that resolved. And again, we're not about shaming people or, oh, why did you do that? Or it's okay. Let's get back on track and let's take a look at this and see what we can do to help. So no income requirements for LSSI services either.
Right. Are there any other questions that people want it's probably put them in the chat box. There's any other things? Add? Well, I'm going to ask them if our goal was to get this, we realize how valuable everybody's time is. So our goal was to make this webinar as helpful as we could in under an hour for anybody listening. And we know that we are recording it, and that out of these Prenatal and Infant Care Network, or the PIC network, we usually have 50 plus people who go back to the recordings to get the information. So we wanted to keep it helpful and short for all of them too. So if there aren't any other questions, I'm going to just turn it over to the speakers if they have a closing comment, piece of sage advice they want to pass on to the group. and we'll turn it over to you guys. Lisa, Kristi, Libby, any last comments?
I just want to say thank you to the group for allowing us to come on and share our programs. And I really look forward to the opportunity to work with a lot of you that we might not have before and to make those connections. And so, please don't hesitate to reach out. I look forward to the chance to speak with all of you if you have questions for us.
And I guess I will just completely piggyback on what Lisa just said. Thank you to Meg and Laura for putting this together to give us this opportunity to talk a little bit about kind of our concerns and what we're seeing. And I see some familiar names on the registration. So we miss seeing everybody. The camaraderie is certainly missed, especially when you do the work that we do. And so missing our friends and in our partnerships. But if anyone has questions about our programming, they can definitely reach out to me. We do have some referral guidelines, and so I will walk you through that if if that's something that you're interested in. We're definitely a resource for all of you, and we look forward to hearing from you too.
And I think I just have a big ditto. I mean, being part of our prenatal and infant care network is amazing. And so it's just amazing to be able to have you two share your expertise. But every time I come to these, I love that I fill a sheet full of takeaways. So thank you.
And thanks to all of you too that are out there doing the work, and we're essential employees, so that you're working every day and you're putting yourself at risk. And so please know that we appreciate all of you and everything that you're doing, and continue to be safe. And we'll all get through this, but we'll do this together. And I think that's what's so great about partnerships and collaboration is we know we're not in this by ourselves. And so to know that you have support and partners in all of the organizations. So thanks to all of you as well.
Well, a big thank you to everyone out there. I don't know if what I would like to share with everybody is that within about a day or so, you will get an email with us with a survey. We really want your feedback on what was helpful here, what are additional things you want information on, so we can keep the information flowing and the camaraderie in the community, since we can't do it face to face and I can't catch you in the parking lot after this meeting to say, what did you think about it? So please let us know. We will be sending that out along with links to this, a recording of this to share with anybody else on your teams, or if you want to get the information out. But, we have some additional funds, I think, at SCAN is identified up through June 30th. Let's all do our best to get that surge that they're predicting in low-income housing. Let's hold that down effectively in Northeast Indiana, Northern Indiana. I know that a lot of this work covers all of Northern Indiana, and I see names on here from throughout the region. So hopefully we can all get a few more connections. So thank you guys very much for your information today, for sharing, and for everybody in participating for the work you're doing out there. Thanks.